All right. Hi, I'm Dr. Ummat, one of the ear, nose, and throat specialists here with Remmie, and I'm here to show you today about how to do photographs on the Remmie application and as well do a submission so we can look at your pictures and try to help you with the diagnosis. So the first step in opening the Remmie app is when you go to your phone is you'll actually find the icon on your main screen and hit the application icon. It opens up the application itself. Once the app is open, you will see something that says Live View Offline, which is kind of a blank screen, and then that allows you to then plug in the device. Once the device is plugged in to your USB-C or your Lightning adapter port, then you will see that the device is still not turned on. You now want to turn the device on by hitting the power button. Once the power button is hit on the device, you will see the light itself. Once the light turns on, it will then come up with saying device is connecting. So now your device is connected, you will actually start to see a live view of your screen. At this point, I usually will hand the device off to the person I'm trying to take pictures of, and then I'll take an alcohol wipe. You can use rubbing alcohol with just some tissue paper, or you can get these disposable wipes, and I'll wipe the actual tip of the speculum, the little black part here, as well as the tip itself. I do it gently. I mean, it is a camera, so you don't want to scratch the lens, but it is something that you can put your fingers on and just gently press. I like to keep my finger on the actual lighted area for just about 10 seconds or so as I'm wiping it to warm it up so it doesn't fog. It makes a big difference when you're taking these pictures. So once it's ready to go, take the cotton away. Then I'll start by putting the patient in a slightly angled position, and then I'll hold the ear and pull the ear back. This is really important to be able to get a very straight view of the ear canal. So as you come in and as you start to pull the ear back, you want to be gentle. You don't obviously want to pull it back really hard. You want to let the person know that you're going to be gently pulling back on their ear to see better. And so you grasp it with your finger and your thumb and just pull it back gently. And as you start to pull it back, you can actually start to bring your device in. Now, once your device starts to come into the ear canal, I use my thumb to stabilize the device so that I'm not basically not shaking all over the place. A lot of times you're nervous because you don't want to touch the ear canal, you don't want to hurt somebody. So if you stabilize with your thumb, and then as you go in, you start to slowly insert the device. Follow the picture, follow the center of the screen, and as you go in deeper and deeper, you want to be super careful to go very gently and try to stay in the middle of the ear canal. As you get in deeper, you'll start to see boxes show up. These boxes are the guide boxes for which have been developed to show you where the eardrum might be, and also where the bone that's attached to the eardrum might be, which is the malleus. And at this point, you start to see those boxes. That doesn't mean you should stop and take a picture there, because your picture will still be potentially blurry and not clear enough. So you want to go, again, a little bit deeper. And we're talking, of course, millimeters, but it's just slow and steady. And as you bring the device in a little bit further, you will now see a really clear shot, a really clear picture of the eardrum. And that's when you'll go ahead and click the picture button, which is at the top of the device. And you can take 3 or 4 or 5 pictures, as many as you feel comfortable. You can also have the person hit the photo button on the app and take their own picture. That's another way to do it if you want to do it that way. And then once you finish taking the pictures, you slowly bring the device back out. And then once you bring it back out, you will gently let the ear go. The key here is to make sure the patient is stable, steady, you've got good handle of the ear canal or the ear itself, and you've warned the patient that you're going to go in a little deeper, so you're communicating the whole time with the person, so that way they don't feel like you're going to just, shove it into the ear and hurt the patient or hurt the person. Very important, because most people are very apprehensive about letting anything go in that deep. Even with a Q-tip, you tend to be pretty careful. So once you've taken the pictures, then you are now ready for a submission. And that's when you bring the phone back to yourself, and then you hit the plus button, and then you do the submission.